My name's Ibrahim. I'm a Trainee Behavioural Specialist for Care Opportunities. What drew me to the role was the in-house multidisciplinary team. The clinical teams featured of behavioural specialists, clinical psychologists and assistant clinical psychologists as well. We work with a range of adults with different needs, so it is quite helpful to have that in-house team, where some adult care social providers might wait weeks or months for that professional service. We have it there to respond to needs straight away. And what I also appreciated was the company's commitment to data-driven, person-centred work. Because some places you might get staff that say, oh, this person's been doing this today and that, so forth, but without actually having data to prove and verify, it makes it a lot harder for people to do their jobs as well as they normally do. Been with the company for 2 years now and it's gone quite quickly. I've got to admit, there's been so many different projects, so many different assessments, sessions, that it's gone quite fast and I've really enjoyed it. So what got me into the industry to begin with, I started out as a domiciliary support worker in 2015. So I worked with adults who had physical disabilities, who couldn't take care of themselves the way they would normally like to. And that kind of got me introduced to the role, got me to grips with what's involved and how delicate and person-centered care needs to be. Afterwards, I then went to a support worker role, working with adults with complex needs. I really enjoyed that. I found that to be very exciting, helping them achieve their goals. And I thought to take that career further, and that inspired me to go and do my degree in behavioural sciences at Buckinghamshire University. I then went to do my master's in psychological sciences at Brunel University. So my day normally involves, it could be a weekly Teams meeting involving the clinical staff and the managers of the homes, where we'll get together and we'll go through individual service users' current period. So it could be the last 2 weeks, what they've been up to, how their health is, anything we need to be aware of in regards to their physical well-being, and mental well-being. We also do things like specialised training for staff to empower them to do the best that they can on their role. We can also do things like comprehensive and holistic assessments to figure out a person's current level of needs. And then we work with them to do tailored skill sessions to build those skills and really tap into their potential. What sets Care Opportunities apart from the others? Well, I've mentioned before, we're committed to data-driven, person-centered work with an in-house clinical team. We're able to respond to needs as they arise, so we can be proactive in our support. And also, we're able to provide a commitment to making sure that they achieve what they want to achieve with the least amount of risks to their physical or mental well-being. Anyone applying for the role would be to embrace this opportunity. If you're somebody that's committed and interested in learning about this field and you want to grow and develop, this is the place to do it, because not only will you be supported professionally, but also personally to grow within your career.